There are three domains of measurement in lupus that we need to think about. The first is how to measure disease activity. How bad is my disease today? The second is how to measure response to treatment. A good treatment should make the disease activity go down, but how do we measure that? And the third is to measure a destination state, a target state. It's not good enough to make the disease activity go down, we want to make it go away. So how do we determine that state where the disease activity is gone? Remission, we call that. Or when there's disease activity that's low enough that the patient is protected from a harmful outcome, and we call that low disease activity. So measuring disease activity, we're using still in our research measures that were invented 30 years ago. They have some good characteristics, but also some problems. They're not very good at measuring changes in disease activity from one time to another. And that means that when we use them to measure the response to medicine, they're not very good at measuring level of improvement in patients. When we use these measures in a trial, if the measures work that show the medicine worked using this measure, probably that is true. But it's possible for the measurement to fail and for a medicine maybe that is good to not look good because we didn't use the right measure. So we think there's a big project of work needed to fix the measurement for clinical trials so more medicines can be available. Finally, it's good news that low disease activity and remission, now we have a very good definition of those. That's now widely used in research, starting to be used in clinical practice, and now being used in trials too. And the good news is that now 4 or 5 of the new medicines for lupus that are being studied have shown improved ability to attain low disease activity. That's the state that protects you from long-term harm. So I hope that the new medicines coming will improve the chances to achieve low disease activity and protect the patient from a bad future.